So I spent 23 years in traditional medicine in urology practice here in Sarasota, Florida. Busy practice doing robotic surgery. Launched the robotics program here in 2006.
I think you were the first one to use the Da Vinci, weren't you?
Did the first couple cases here, and really grew a big surgical practice here. And I was doing great. I was very happy until I wasn't. Right. So I hit a wall about halfway through my career, like a lot of other doctors, where I wake up one day and I'm 30 pounds overweight.
Right.
I'm miserable. I'm stressed out. I'm not sleeping well. I'm not taking care of myself. You know, I've neglected myself for the sake of my practice. And you know, traditional medical care, our system is built on this idea that doctors have to grind harder, work harder, self-sacrifice, and then that's really like a badge of honor. And
it
we
really
all
is.
Yeah, we all fall for that.
We really do. You know, the more I work, the better I am. And if I work more than you, I'm better than you.
Yeah, you know, I'll sleep when I'm dead kind of concept.
Right, exactly.
Yeah.
And I had a similar point where I realized that's a big old lie.
Yep.
Big
Exactly.
old lie. But I'm sorry, you go ahead.
Exactly. Yeah. So I wake up one day and I'm miserable. I'm unhappy in my career. I'm unhappy in my life. And I'm married now. We have a baby on the way. And I realize that something has to change.
Yeah.
And so I go to a local doctor here in town, concierge doctor, for my first physical ever. I'm 40 years old.
First physical ever.
First physical ever. And doctors are guilty of this, right? We don't see a doctor ourselves because we're invincible. And who has time? I got to focus on my own patients.
Exactly.
I don't have time for myself.
Exactly.
And so it was a very vulnerable experience. I remember sitting on that exam table. You know, I was so used to being on the other side of that interchange.
Right.
But now I'm suddenly the patient. I'm on this exam table. I'm sitting there with a thin little paper gown, barely covering some very important real estate.
Right.
You know what I mean?
Right.
And it was an eye-opening experience that I had to really face my own mortality and realize that something had to change.
Right.
What changed everything for me was that moment, though, because this doctor really didn't have any great answers other than I probably need to take a statin.
Of course.
Right?
Right.
That's the answer to everything, right?
Right. Exactly.
And you know, lose weight, exercise, eat healthy, that kind of, you know, generic recommendation, but no real clear guidance.
Right.
Just lose weight and take a statin. So I go home that day, and I was really confused, scared. And I knew something had to change, but I had to really humbly recognize that here I was. I'm this urologist, this men's health expert, and I had no idea either.
Right.
I didn't know what the hell to do. You know, they say eat healthy. Was it really? Yeah, you know, eat healthy and exercise. But
because we got a ton of education on nutrition in medical school and training, right? Just a ton.
Right. Dripping with sarcasm. Exactly.
Exactly.
You get nothing.
Nothing.
Yeah, nothing.
Absolutely nothing.
Around nutrition, around fitness, around stress, around sleep, around environmental toxins, around community, around relationships. None of that.
None of it.
It's all find the diagnosis and here's the drug. Right? Diagnosis, drug, diagnosis, drug. And that's really what we do.
If I may jump in,
Yeah.
I read something just recently that it really succinctly ties it together. The regular medicine, Western medicine, talks about what's wrong.
Yeah.
So this is what's wrong, so take this pill. Your cholesterol is high, take this pill. They don't address the why is it wrong, which is the root cause.
Yeah.
And that's ultimately what I'm learning is where we need to be focusing our attention. Okay, so here you are with this crossroads in life. What do I do? Where do I go from now?
Yeah, I gotta turn my health around, and I realized that from a career standpoint, something's got to change because I'm just not happy. I can't imagine doing what I was doing for the rest of my life. Right. And so I find this entire new world of precision medicine. Okay, now what does that mean? I started with a certification program in learning how to read genetics, so I can take a cheek swab of someone and look at genetics that help guide what should I eat, what should I not eat, what supplements do I need, how do I clear toxins better, how do I get my my gut to work better, how can I sleep better, what exercise is right for me, and all these genetic insights I learned. How you can really personalize lifestyle medicine, you know, personalize what to do from a behavior perspective. And I suddenly realized, holy cow, there's a lot more to it than I was ever taught in medical school.